Life in the Western world is very much an existence of excess, where the greatest need is a faster pace and the strongest ally, progress. Meanwhile, a world away, developing nations want for the basic needs of human life. Nowhere is the disparity as evident as in the healthcare system. American hospitals discard an estimated 2 million tons of material each year into landfill sites, some of it unused or functional equipment simply outdated, while for many clinics in the developing world, the shelves are bare. Even when skilled practitioners exist, some patients will travel for miles only to find a doctor lacking the basic resources to properly clean and stitch a wound or protect the patient or themselves from infection.
They had a little building, a little room, a nurse's station, and you open the cabinets and there was nothing there.
I've seen where they have patients laying head to toe and or on the floor because you might not even have beds at all. So we did not have sutures, we did not have a very good supply of gloves. So we took our latex gloves and washed them out and hung them out to dry and reused them till they fell apart. And a lot of the patients, if you had a machete wound and needed to be sutured, before that could happen, they would have to send someone up to the pharmacy to buy the packets of sutures and bring it back down to the clinic before anything could be done.
Common sense says there must be a way to build a bridge between the need in the economically developing world and discarded surplus in the United States. We believe MedShare International is that bridge. MedShare pairs surplus medical supplies with needy healthcare facilities in underserved communities around the world. As we have so much to give and their needs are so great, sharing can make a world of difference.
The concept was very simple. We have the surplus here in this country. The need is tremendous over there in other parts of the world. How do we bring those two together to get this surplus to the place where it can save lives and improve health care? I'm a firm believer that, number one, we need to operate our lives and live our lives in our institutions out of a sense of abundance. There's enough to go around. Whether we're talking about food or health care or whatever, there's enough to go around. The issue is distribution and sharing.
MedShare Circle of Sharing is essentially a recycling program for usable medical supplies. MedShare gives hospitals and medical product companies a socially and environmentally responsible alternative to simply throwing away surplus, unused, and usable items. MedShare diverts these materials from landfills by setting up collection barrels in partnering hospitals. Barrel contents are transported to MedShare, where the materials are meticulously evaluated and sorted. The items are inventoried and stored with other medical materials and equipment being prepared for shipment to recipient healthcare centers across the economically developing world.
There's a great business strategy for MedShare. These materials and products are free. They would be disposed of. But the magic, if you will, is in making the match between these supplies, products, and equipment, and a need. We don't want to send something where it can't be used, where the electrical outlet won't accommodate the piece of equipment, where it doesn't work, where there's no manual for it to work, or where they already have an adequate supply of sutures or bandages, and what they really need is gloves.
From a 48,500 square foot facility in Decatur, Georgia, MedShare staff and volunteers sort, evaluate, rebox, and inventory the medical supplies. The inventory is posted online and updated throughout the day for web-based viewing. This allows recipient hospitals to see exactly what MedShare has in its warehouse. Recipient hospitals and clinics can then personally select the medical supplies they need and the quantity, item by item, box by box, thus eliminating unnecessary waste. MedShare's unique system of online ordering provides phenomenal efficiency by concentrating staff and volunteer efforts on real needs rather than assumed ones. The arrival of a MedShare shipment is always a special day for recipients. Letters, photographs, and visits say it all.
The stories are magnificent, and they're life-changing and helpful to save people's lives. So it's a really a very sophisticated operation in many ways, and it's working.
Just from what I saw in my little village, I would say you can't believe what a difference it can make. They were just so excited. It was like Christmas for them. Because of MedShare, things get all around the world, all kinds of needy people. And also it builds relationships.
I think MedShare is definitely a bridge that connects America with maybe other countries around the world. And it's not about money, it's not about business, it's about helping others and helping the community outside.
Par la somme et la variété du matériel récupéré.
I've been very impressed by the quality and the amount of material available.
MedShare is a wonderful place.